Hello friends, let us now learn some important points about follicular carcinoma of thyroid. Okay, this follicular carcinoma of thyroid is actually the second most common carcinoma, followed by papillary carcinoma of thyroid. This follicular carcinoma accounts for around 5 to 15% of cases of thyroid cancer, and it is most commonly seen in females when compared to males. Follicular carcinoma is of different types. There are two variants of follicular carcinoma are seen. Okay, we have in follicular carcinoma, we have two variants of follicular carcinoma is seen. One, we have minimally invasive. It is just minimally invasive follicular carcinoma of thyroid. Second, we have widely invasive follicular carcinoma of thyroid. In minimally invasive follicular carcinoma of thyroid, you will see that the lesion is encapsulated. That is, there is a capsule surrounding the lesion is seen, and it also sees, if you see the histological demonstration, you will have to see that there is invasion of the capsular blood vessels, or this fibrous capsule gets invaded. So there is capsular invasion is seen. Okay, in minimally invasive follicular carcinoma. In widely invasive follicular carcinoma, it is not well encapsulated. So the carcinoma, follicular carcinoma is not well encapsulated, okay, and it will invade the vessels. It will invade the vessels directly adjacent to the thyroid tissue. It will invade the vessels, and through that it goes into the blood, and it results in distant metastasis. So this is a type of cancer which in which the most common route of spread of disease is by hematogenous route, that is through blood. So through from distant metastasis, it might reach bone, resulting in bony lesions. It might reach lung or brain or liver, causing liver failure. So all these can occur. So this widely invasive follicular carcinoma, this will metastasize in 20 to 40% of cases. It will show metastasis to distant organs. Whereas in minimally invasive type of follicular carcinoma, it will metastasize only in 5 to 10% of the cases will undergo metastasis. So we have two variants, that is minimally invasive type of thyroid follicular carcinoma of thyroid. The second type is widely invasive follicular carcinoma of thyroid. Then, if you see the diagnosis in the follicular neoplasm, obviously you will see that there is a hypoechoic nodule is seen. Okay, and even here you can see a hypoechoic nodule. It's seen in both these cases. You will see that there is bigger nodules, hypoechoic nodules are seen. But as such, we cannot say that this is a follicular carcinoma, because the main diagnosis of follicular carcinoma is histological, that is pathological, histological, histopathological correlation, but not by normal way, because follicular adenomas and follicular carcinomas only differ in vascular and capsular invasion, which can only be diagnosed by microscopic evaluation, not by ultrasonography. So this is also a picture showing the oval, homogeneous, well-defined hypoechoic masses. Okay, same, all these are similar masses which are seen, which are almost similar to benign neoplasms. The only way is to differentiate is by surgical removal and histopathological correlation. Then, is FNAC diagnostic in follicular carcinoma? FNAC is not useful in follicular carcinoma. Then, sonography for diagnosing are differentiating benign versus malignant thyroid follicular tumors. So the sonography, that is actually ultrasonography, is also not useful for differentiating the benign versus malignant lesions. Then, but there is one way we can at least differentiate. Then, how should we differentiate between follicular carcinoma and follicular adenoma? The only way to differentiate is by surgical removal should be done, and then do a pathological diagnosis by histopathological examination. Okay. Then, are there any features which are suggesting that it is a follicular carcinoma of thyroid based on ultrasonography? On ultrasonography, if the patient has irregular tumor margins, if there are irregular tumor margins, or if there is thick irregular halo, or if the patient has tortuous blood vessels, tortuous internal vessels. So all these can, predispose or tell us that it can be a malignant or follicular carcinoma of thyroid. Thank you.